What to eat in Stage 3. Kidney disease. Complete food guide plus warning signs. You got the diagnosis, and now you are sitting there wondering, what do I even eat anymore? That moment can feel really overwhelming, and honestly, most people in your position have no idea where to start. Here is what nobody tells you early enough. What you eat right now at Stage 3 can genuinely slow things down and protect what kidney function you still have. In this video, you will learn exactly what Stage 3 kidney disease means, the early warning signs most people ignore, and a clear, simple daily food guide you can actually follow. Let us get into it. So let us start at the beginning, because before you can make smart choices about food, you need to understand what is actually happening inside your body right now. Stage 3. Kidney disease. Your kidneys are two small organs, roughly the size of a fist, sitting just below your rib cage on either side of your spine. And despite their size, they do an extraordinary amount of work every single day. They filter your blood, remove waste, balance fluids, control blood pressure, and even help your body produce red blood cells. Think of them as your body's quiet, tireless cleaning system, running in the background without you ever having to think about it. Now, when doctors talk about kidney disease stages, they are measuring something called your GFR, which stands for glomerular filtration rate. Do not worry about the name. All it really means is how well your kidneys are filtering your blood. A healthy kidney filters at full capacity. As kidney function declines, that number drops. Stage 3 means your kidneys are working at somewhere between 30 and 59% of their normal capacity. Now, that might sound alarming at first, but here is something important to hold on to. Stage 3 is the stage where your choices genuinely matter the most. You still have meaningful kidney function. And with the right approach, many people at this stage are able to slow the progression significantly, sometimes for years. There are actually two parts to Stage 3. Stage 3A means your kidneys are filtering between 45 and 59%. Stage 3B means filtering between 30 and 44%. The distinction matters because Stage 3B requires closer attention and often more careful dietary adjustments. But in both cases, the kidneys are still working. They just need support. Here is what tends to happen at this stage that most people do not realize. Your kidneys begin to struggle with filtering out certain minerals and waste products efficiently. Things like potassium, phosphorus, and sodium start to build up more easily in the blood. And when those levels rise too high, they begin to affect other parts of the body, including your heart, your bones, and your energy levels. This is exactly why food becomes so important at Stage 3. Because every meal either supports your kidneys or adds to their burden. Now, one thing worth understanding is that kidney disease at this stage is often called a silent condition. Many people feel relatively normal for quite a while. Life carries on. You go to work, you look after your family, you do your daily routine. And because the symptoms can be subtle, it is very easy to underestimate what is happening internally. That is not said to frighten you. It is said because awareness is genuinely powerful here. When you understand what your kidneys are dealing with, you stop making random choices and start making intentional ones. Stage 3 is also the point where lifestyle changes have the strongest impact. Research consistently shows that people who adjust their diet, manage their blood pressure, stay hydrated appropriately, and reduce certain foods can slow kidney decline in a real and meaningful way. This is not about perfection. It is about consistency over time. So think of this stage not as a door closing, but as a window opening. A window where your daily habits carry real weight, and where the right information can genuinely change your trajectory. And that leads us directly into something that catches a lot of people off guard: the symptoms. Because Stage 3 does come with warning signs. They are just easy to miss if you do not know what to look for. Before we go further, I want to ask you something personal. Are you watching this because you or someone close to you has just been told their kidneys are at stage 3, and you are trying to make sense of what that actually means for daily life? If that is you, type 1 in the comments right now. And if you are here because your doctor mentioned your kidney function is declining and you want to get ahead of it before it gets worse, type 0 on. I read every single comment, and knowing where you are helps me create content that speaks directly to what you are going through. If you want clear, honest guidance on kidney health that skips the confusion and gives you real answers, subscribe to the channel and turn on the notification bell. This kind of information could genuinely change the direction of your health journey. As we just covered, stage 3 kidney disease can quietly progress while life feels almost normal on the surface. But your body is rarely completely silent. It sends signals, and the problem is that most of those signals look like other everyday things: tiredness, a bit of puffiness, needing the bathroom more at night, so people brush them off, attribute them to stress or age, and carry on. Early warning signs. That is exactly what we want to change right now. The first and most common sign is fatigue that feels different from ordinary tiredness. Not the kind you feel after a long day at work. This is a deeper, heavier exhaustion that does not fully lift, even after a good night's sleep. When your kidneys are not filtering efficiently, waste products begin to accumulate in the blood. That buildup affects your energy at a cellular level, and no amount of rest fully resolves it. If you have been feeling unusually drained for weeks without a clear reason, that is worth paying attention to. The second sign involves changes in urination. This is one of the most telling indicators, yet one of the most commonly ignored. You might notice you are urinating more frequently, especially during the night. Or you might notice the opposite, that you are going less often than usual. Some people notice their urine looks foamy or bubbly. That foaminess can indicate protein leaking into the urine, which happens when the kidney filters are under strain. Any persistent change in your bathroom habits is something to take seriously and mention to your doctor. Swelling is another sign that tends to creep up gradually. It usually appears in the ankles, feet, and sometimes around the eyes, particularly in the morning. When the kidneys are not managing fluid balance properly, the body begins to retain water in the tissues. Many people assume swollen ankles are just from standing too long or the heat, and sometimes they are. But when it keeps coming back, especially in the morning or without an obvious cause, it is your body asking you to look a little closer. Then there is skin that feels persistently dry and itchy. At stage 3, phosphorus can start to build up in the blood. One of the ways that imbalance shows up is through the skin. It becomes dry, irritated, and itchy in a way that creams and moisturizers do not really fix, because the issue is internal, not external. It is an easy thing to dismiss as a skin condition, but combined with other signs, it fits a recognizable pattern. Some people also notice a change in appetite. Food starts to taste different, sometimes metallic or just off. This happens because waste products like urea build up in the bloodstream and affect taste perception. When eating feels less appealing than it used to, and there is no obvious reason like stress or illness, that shift in taste can be a quiet signal worth noting. Difficulty concentrating and a kind of mental fogginess is another symptom that gets overlooked. When waste builds up in the blood over time, it affects brain function too. People describe it as feeling like they are thinking through fog, struggling to focus on simple tasks, or feeling mentally slower than usual. None of these signs on their own confirm kidney disease, but together, they paint a picture that deserves attention rather than dismissal. Your body communicates with you constantly. Learning to listen to it calmly and without panic is one of the most powerful things you can do at this stage. And once you understand what your body is telling you, the next natural question becomes, what can you actually do about it starting today? That is exactly where we are heading next. Eat daily and avoid. Now that you understand what your body is going through and what it is trying to tell you, let us talk about the part that makes the most immediate difference to how you feel day to day. what you put on your plate. And before anything else, one important point. Everyone with stage 3 kidney disease is different. Your blood work, your other health conditions, and your specific situation all matter. So while this guide gives you a strong and reliable foundation, always work alongside your doctor or a renal dietitian to fine-tune things for your individual needs. With that said, let us start with what genuinely supports your kidneys. Water is the simplest and most overlooked tool you have. Staying well hydrated helps your kidneys flush out waste more efficiently. Most people at stage 3 can drink normal amounts of water, around 6 to 8 glasses a day. However, if your doctor has advised you to limit fluids, follow that guidance. Hydration supports kidney function, but the right amount is personal. Cauliflower is one of the most kidney-friendly vegetables you can eat. It is low in potassium and phosphorus, and it is incredibly versatile. You can steam it, mash it, roast it, or blend it into soups. It gives you real substance in a meal without putting unnecessary strain on your kidneys. Cabbage is another excellent choice. It is gentle on the kidneys, high in fiber, and easy to prepare in many different ways. Boiling or steaming vegetables like cabbage also helps reduce their potassium content further, which is useful at stage 3. Berries, particularly blueberries and strawberries, are rich in antioxidants and relatively low in potassium compared to many other fruits. They support overall health without overwhelming the kidneys, and they make a genuinely satisfying and natural sweet option. Egg whites are a good source of protein that is easier on the kidneys than red meat. At stage 3, your kidneys begin to struggle with processing large amounts of protein waste. Egg whites give you quality protein with less burden on the filtering system. Olive oil is a simple, healthy fat that supports heart health, which matters greatly at this stage because kidney disease and heart health are closely connected. Using olive oil in cooking instead of butter or processed oils is a small but meaningful daily shift. Now let us talk about what to reduce or avoid. Sodium is one of the biggest concerns at stage 3. High salt intake raises blood pressure, and high blood pressure is one of the leading causes of kidney decline. Processed foods, tinned soups, ready meals, and fast food are loaded with hidden sodium. Cooking at home with herbs and natural flavorings instead of salt makes a real difference over time. Phosphorus is found in high amounts in processed cheese, dark fizzy drinks, packaged snacks, and certain dairy products. When phosphorus builds up in the blood, it affects your bones and your heart. Reading labels and reducing ultra-processed foods is one of the most protective habits you can build. Potassium needs careful management too. Foods like bananas, oranges, potatoes, and tomatoes are naturally high in potassium. That does not mean eliminating them entirely, but being mindful of portions and preparation methods matters at this stage. Red meat and processed meat put significant strain on the kidneys due to the volume of waste they produce during digestion. Reducing portion sizes and choosing leaner, lighter protein sources a few days a week is a realistic and effective adjustment. Small, consistent changes to your daily eating habits genuinely accumulate into something meaningful over months. This is not about restriction for its own sake. It is about giving your kidneys the best possible environment to keep doing their job. And as we bring everything together in the final section, you will see exactly why these changes, paired with the right mindset, can make a lasting difference. If what you are learning right now is giving you a clearer picture of how to actually eat for your kidney health, please take just a moment to hit the like button. That one small action tells the platform that this kind of honest, practical health content deserves to be seen. Somewhere out there, someone is sitting with a stage 3 diagnosis feeling completely lost about what to put on their plate tonight. Your like could put this video in front of them at exactly the right moment. That is not a small thing. That is you genuinely helping someone else find their way through something really difficult. You have just covered a lot of ground in this video, and if you have made it this far, that tells me something important about you. You are not someone who is giving up. You are someone who is showing up, looking for real answers, and taking this seriously. That matters more than you might realize. So let us bring it all together, calmly and clearly. Your kidneys are remarkable organs that work quietly every single day to keep your body balanced and clean. When they begin to slow down at stage 3, it does not mean the situation is out of your hands. It means the choices you make right now carry more weight than they ever have before. And that is actually something to feel empowered by, not frightened of. You now understand what stage 3 kidney disease actually means. It is not the final stage. It is not a point of no return. It is a stage where your kidney function is reduced, but still present, still working, and still very much worth protecting. Knowing that gives you something solid to stand on. You also now know the warning signs that are easy to dismiss, but important to take seriously. The deep fatigue that sleep does not fix. The changes in urination that seem minor but carry meaning. The swelling in your ankles and feet keeps coming back. The itchy skin, the shifted appetite, the mental fog. These are your body's way of communicating with you. And now you speak that language a little better. You have a clearer picture of what to put on your plate and what to pull back from. Gentle, kidney-friendly foods like cauliflower, cabbage, berries, egg whites, and olive oil. Habits like reducing sodium, being mindful of phosphorus and potassium, and stepping back from processed foods and red meat. None of these changes require perfection. They require consistency. Small, steady steps taken day after day are what genuinely shift the trajectory over time. And perhaps the most important thing to carry with you from this video is this. You are not managing this alone, and you do not have to figure it out through guesswork. Working alongside your doctor or a renal dietitian, staying informed and making intentional daily choices is a combination that has helped countless people at stage 3 live well and slow progression meaningfully. There is real hope here. Not the empty, reassuring kind that glosses over the difficulty. Genuine, grounded hope based on the fact that stage 3 is a manageable condition when approached with awareness and care. Now, if this video helped you see things more clearly or gave you something practical to take away, it would mean a great deal if you gave it a thumbs up. It takes just a second, and it genuinely helps this kind of honest, straightforward health content reach more people who need it. If you have a question, a personal experience, or something you would like to understand better, drop it in the comments below. Every comment gets read, and your question might be exactly what someone else watching this video needed to see answered. And if you are not subscribed yet, now is a good time. Because this channel exists for one reason only: to give you clear, calm, trustworthy health information that actually helps you live better. No complicated jargon, no scare tactics, just real guidance for real people. There is more coming on kidney health, including what drinks to choose, how sleep affects kidney function, and natural ways to support your kidneys every day. You showed up today. Keep showing up. Your health is worth it.